You're sitting at your desk when suddenly, bam, a sharp pain shoots through your chest. Your heart races. Is this it? Am I having a heart attack? But wait, maybe it's just heartburn. How do you tell the difference when every second counts? Here's the truth that could save your life. According to the Centers for Disease Control and Prevention, approximately 805,000 Americans have a heart attack every year. That's one every 40 seconds. But here's what most people don't know. Studies published in the American Heart Association journals reveal that up to 60 million Americans experience heartburn at least once a month, and 15 million deal with it daily. So when chest pain strikes, how do you know which one you're facing? Let me walk you through exactly what your body is telling you. First, the 4 signs that say it's probably heartburn. Sign number 1, the burning sensation. According to Mass General Brigham cardiologists, heartburn typically feels like a burning sensation moving up from your stomach toward your throat. Research published by Harvard Medical School confirms that this happens when stomach acid flows back into your esophagus. Here's the key difference. Heart attack pain feels like pressure, tightness, or squeezing, not burning. If you can point to exactly where it hurts with one finger, that's actually a good sign. Harvard cardiologists note that heart attack pain is usually more diffuse, spreading across a broader area about the size of your closed fist. Sign number 2, when and how it happens. Here's something crucial from UC Davis Medical Center research. Heartburn symptoms typically appear after eating, especially after large or spicy meals. The pain worsens when you bend over or lie down because gravity allows stomach acid to flow upward more easily. In contrast, a heart attack often occurs during physical exertion or stress, though it can happen at rest too. But if your chest pain consistently shows up right after that burrito or late-night pizza, your esophagus is likely sending you a message, not your heart. Sign number 3, the antacid test. Mass General Brigham physicians use this as a quick differentiator. If your pain improves within minutes after taking antacids, it's likely heartburn. Heart attack pain doesn't respond to antacids. If you've had this type of chest discomfort before and antacids always help, that's another strong indicator. Studies from Johns Hopkins Medicine show that this response pattern is one of the most reliable ways to distinguish between the two conditions. Sign number 4, the duration game. According to the American Heart Association, heartburn usually goes away after a few minutes or hours once your stomach has digested its contents. If your discomfort comes and goes, especially in relation to meals or position changes, it's more likely to be acid reflux. However, and this is critical, Harvard Medical School cardiologists warn that if chest discomfort persists for more than 15 minutes and doesn't improve with rest, you need immediate medical attention. But here's where things get serious. The 3 warning signs that mean emergency. Warning sign. Number 1, radiating pain with breathing difficulty. Research published in the Journal of the American Heart Association shows that heart attack pain often radiates to your left shoulder, arm, neck, or jaw. If you're experiencing chest pressure that spreads to these areas, and you're short of breath, breaking into a cold sweat, or feeling nauseous, call 911 immediately. Don't wait. Studies from Brigham and Women's Hospital found that women, in particular, may experience less typical symptoms, including nausea, vomiting, and shortness of breath rather than classic chest pain. Nearly 40% of women who had heart attacks reported heartburn-like symptoms shortly before, according to UC Davis research. Warning sign number 2, sudden, severe, tearing pain. Here's something that could save your life. If you experience sudden, severe chest or back pain that feels like something is tearing or ripping, you might be experiencing an aortic dissection, a tear in your body's main artery. According to the National Center for Biotechnology Information and Mayo Clinic research, this condition is catastrophic and often fatal without immediate treatment. The pain typically reaches maximum intensity immediately, unlike heart attack pain, which can build gradually. If you experience this tearing sensation along with sudden fainting, stroke-like symptoms, or a difference in blood pressure between your arms, this is a life-threatening emergency. Warning. Sign number 3, sharp pain with sudden breathlessness. Cleveland Clinic and Johns Hopkins research identifies pulmonary embolism, a blood clot in your lung, as another serious cause of chest pain that's often misdiagnosed. The sudden onset of sharp chest pain that worsens when you breathe deeply, combined with shortness of breath, rapid heartbeat, or coughing up blood requires immediate emergency care. Studies show that symptoms can be subtle, but PE blocks blood flow to your lungs and can be fatal if untreated. Now, there's one more cause of chest pain most people miss: the panic attack paradox. Research published in the Primary Care Companion Journal for Clinical Psychiatry reveals something startling. 30 to 50% of people with chest pain and normal coronary arteries actually have panic disorder. Studies from Beth Israel Deaconess Medical Center show that panic attacks trigger the body's fight-or-flight response, causing real chest pain, racing heart, and shortness of breath, symptoms that can perfectly mimic a heart attack. Here's how to tell them apart. Panic attacks typically reach peak intensity within about 10 minutes and gradually subside within 20 minutes. They often occur at rest rather than during physical exertion. If you've had similar episodes before that resolved on their own, especially if they're associated with stress or anxiety, panic disorder might be the culprit. However, Beth Israel cardiologists emphasize you should never self-diagnose. If you're having chest pain for the first time, treat it as a medical emergency. The musculoskeletal surprise. Here's something that'll shock you. According to the American Academy of Family Physicians, musculoskeletal causes like costochondritis account for 13 to 36% of chest pain cases presenting to emergency departments. Research from StatPearl's Medical Publishing and Mayo Clinic studies show that costochondritis, inflammation where your ribs meet your sternum, causes sharp or aching chest pain that worsens with movement, deep breaths, or coughing. The key diagnostic feature: your doctor can reproduce the pain by pressing on your chest wall. Studies show that 91% of patients with costochondritis recover completely within 3 weeks with rest and anti-inflammatory medications. The golden rules that could save your life. According to Mass General Brigham cardiologists and the American Heart Association, here's what you must remember. Never spend more than 15 minutes trying to figure out if your chest pain is serious. If you're experiencing chest discomfort along with shortness of breath, cold sweats, nausea, or lightheadedness, call 911 immediately. Don't drive yourself to the hospital. Don't worry about embarrassment if it turns out to be nothing serious. UC Davis Health research confirms that women over 50 with risk factors like diabetes or obesity should be especially vigilant, as they're more likely to experience atypical heart attack symptoms. And if you have a personal or family history of heart disease, don't take any chances. Remember, emergency departments see many patients with chest pain, but studies show that missed heart attacks and aortic dissections happen when people wait too long or dismiss their symptoms. The Houston Methodist DeBakey Heart Center emphasizes that advanced protocols begin immediately when you arrive with chest pain, including ECG, blood tests, and cardiac imaging that can quickly determine the cause. Here's the bottom line: your body knows something's wrong. The question is whether you'll listen carefully enough to know when that something is life-threatening versus uncomfortable but benign. If this information could help someone you know, share this video right now. Hit that like button so more people can learn these potentially life-saving differences. And subscribe to stay informed about health topics that really matter. Your knowledge could save a life, maybe even your own.